Hello, patients at Skin and Beauty Center. I'm Juby, and today I'm here with one of our dermatologists, Dr. Jeff Ashley, representing all of our wonderful providers at SBC to help shed some light on TeleDerm virtual visits. Dr. Ashley is a board-certified dermatologist in practice for over 4 decades. He is a fellow of the American Academy of Dermatology, adjunct clinical professor of dermatology for USC's Keck School of Medicine, and overall just a kind and incredible guy. We're so lucky to have him. Thank you for joining us, Dr. Ashley.
Thank you for that very warm introduction.
So there's been a lot of talk, Dr. Ashley, about telemedicine, telehealth, and for dermatology, TeleDerm visits with the current climate in medicine. We here at SBC want to make sure that all of our patients have the most current information concerning their healthcare options. So what exactly is telemedicine, telehealth, TeleDerm?
It's really sort of a modern version of the old-fashioned house call. It's just like a typical office visit, except the doctor and patient meet in an online private meeting that's held over the internet instead of in a physical clinic. It works great when the patient uses an electronic device like a cell phone or a computer or laptop or even an iPad. But don't let that stop you if you're tech averse, because it's still possible to participate in these meetings just with a telephone. So one way or another, this is working out great, and it's so easy. That's one of the things we'd like to get across.
Okay, so then why are we doing this now? Like, why are we doing all of this virtual visits? Why are we doing that now?
Well, of course, this mainly was stimulated by the coronavirus or COVID-19 crisis, where it quickly became evident that everybody should be staying home. And so the technology for this has been around for quite a while. It's just that the insurance carriers would not reimburse for it. Well, so now they've all come to realize that to enable people to stay home and still get the care they need, that they should reimburse for these televisits or TeleDerm visits in our case, the same as they do for a regular office visit. And that's what's really opened it up for all of us. This allows us at SBC to continue caring for people's important dermatology needs without them having to risk going out in public and coming into a busy clinic.
Right. Can you share some examples with our patients of how it's used in dermatology?
It's so simple. You just call the office like you normally would for an appointment, and we'll set you up for one of these TeleDerm visits, telehealth visits. The next thing that'll happen is you'll receive an email, and the email will have a link to join the meeting at the appointed time. And it also will include a 9-digit code. And so after you click the link, you enter the 9-digit code and poof, you're in the meeting. The thing about this is that pictures are so important. You know, seeing the rash or seeing the skin growth that a patient's concerned about is crucial for us doctors. And so when you make an appointment, our staff is going to give instructions on how you could forward a photograph for the doctor to review prior to the meeting. And that'll make it more efficient and much better quality for the doctor to render a good diagnosis and treatment plan.
Okay, wonderful. But there will be conditions that would require an in-office visit or something that might need an actual physical procedure. How do you address this?
Well, again, in response to the coronavirus crisis, we have drastically reduced our office hours, but we are still there on a limited basis by appointment only. So while we can accommodate walk-ins, if as a result of one of these TeleDerm visits with the doctor determines that you have an urgent problem that can only be dealt with in the office, for example, needing a procedure of some sort, we do have office hours, and the doctor will arrange an appointment for you to come in urgently and get that matter taken care of. So we are still able to do those sorts of things when necessary. But of course, anybody who comes to the office has to be sure to wear a face covering.
Right, absolutely. So I know some of our patients would be curious to see how prescriptions are handled and how the records are being updated.
So the doctor will have a encrypted connection to the patient's chart while conducting these TeleDerm visits. So, for example, I can be talking with a patient just like I am with you right now, and simultaneously I can be submitting a prescription to your pharmacy, and I can be entering data into your chart all at the same time.
Wonderful. So SBC, how are they complying with the stay-at-home restrictions? Stay safe in home. What are they doing extra besides the TeleDerm visits?
Right. Well, as soon as the stay-at-home orders started coming out, we started providing these TeleDerm visits. And gosh, we've conducted hundreds of these already very successfully. So that's the main thing. And we also stopped providing any cosmetic services because those are not essential right at the moment. But as I mentioned, we did maintain limited office hours for urgent problems so that we can still take care of things that need a procedure.
I know that you guys have implemented a texting option called Hello at DermLA. Can you elaborate a little bit on that?
Right. Well, this is a little bit of a pilot program at the moment, but it's working great so far. At our hello at dermla.com site, a patient can email or text a brief question or statement of a problem, and we'll get back to you very promptly to address your concern and set up a method for making sure that you get cared for really quickly.
Wonderful. Thank you so much, Dr. Ashley, for your time. And thank you, SBC patients, friends, and family for tuning in today. If you have any further questions or need more information about how you can schedule an appointment with Dr. Ashley or any one of our board certified providers, please give us a call, 877-822-2223, or you can text us or email us at hello@dermla.com. Thank you so much, Dr. Ashley.
It's been a pleasure, Juby. Thank you.
Thank you. Have a great day.
You as well. Stay safe.